Hi, everyone, and welcome to another episode of our podcast, Adoption and Beyond. My name is Nicole Fowler. I'm the Director of Social Services at Adoptions from the Heart and the co-host of this podcast.
Hi, everyone. My name is Elise White, Social Service Program Manager at Adoptions from the Heart and the other co-host of this podcast.
On today's episode, we have two amazing guests who have great experience in the world of adoption. They're not only experts in their field, but they also happen to be our colleagues. We will be discussing pregnancy options counseling for pregnant people, as well as non-newborn adoptions and the programs AFTH provides.
First, we have Amanda Aliberti. Amanda is the District and Regional Supervisor for AFTH Delaware, Wynwood, and Pittsburgh offices. Amanda is also the Birth Parent Services Manager at AFTH and the host of AFTH TV. Welcome to our podcast, Amanda.
Thank you so much for having me.
In addition to Amanda, we also have Sheila Kowit. Sheila is an adoption social worker at AFTH's Wynwood office. She's also an adoptive mother to two international adoptees. Welcome to the podcast again, Sheila.
Thank you for having me.
Before we get started with our conversation with Amanda and Sheila, we would like to start with our What's Buzzing segment. Myra, what do you have for us today?
Thank you, Elise and Nicole, and welcome Sheila and Amanda to our episode. So for today, What's Buzzing episode, I would like to include Amanda and Sheila in the conversation. So I have for you guys a Dear Abby question from an advice column in the Cleveland.com. I'm going to read the question to you guys, and I would like to know how you would answer to this mother if the question was asked to you. I'm not going to be sharing what the what their answer was. I just want to hear from you guys as social workers what you would say to this person asking the question. So the title of this article is Dear Abby, our adopted daughter's birth mom blabbed to her that she's the real mom. And then the question goes, we adopted our daughter, Opal, at the age of 2. She's now 6. Opal lived with us off and on as a newborn, but by age 1, she lived permanently with us. We live in a small community, so everyone knows everyone. Opal lived with her biological mother prior to adoption. We tried to allow interaction between them with certain rules in place. However, Opal was recently permitted to spend 2 hours with her biological mother at a party for a sibling. Opal asked to come back home, so she was dropped off. I later found out that her bio mom told her that she gave birth to her, so she is her real mom. We never hid the adoption from Opal. We speak about it in a way that it is negative or hurtful. Since this happened, Opal has reverted to being clingy and wakes up with that conversation on her mind. How do I address this with her bio mom and with our daughter? So I will open this to you guys, so any of you can answer this question, and what you think you would answer.
First, I would start with empathy and commending the adoptive parent for having openness with the child's sibling. That's extremely important. And so I want to commend that there. And then I would probably explore the adoptive parent's feelings, what fears come up with that language, and explore positive adoption language and how to navigate through adoption with boundaries. It's not co-parenting, but with also openness and an open heart for the child's biological family as well.
Yeah,
I also,
go ahead, Nicole.
I also just in the response, if I were responding as a columnist to a question such as this, I would educate myself a little bit better. I did not like the language that was used in the title, using blabbed positive adoption language. She was unable to keep her, so she gave her to you. This is just not what we know in the adoption world, and I don't expect a columnist to be completely educated on everything that they answer, but this is a huge life question in this child's life and their identity. So my suggestion would be using positive adoption language in the response as well.
Yeah, I agree, Nicole. And I think it's also, that child seems to be at an age where a lot of questions are coming up. And we're all advocates of adoption-informed therapy, especially for kiddos that are struggling to fully understand A, the process, and B, what all of these terms that are being thrown out really mean. What does it mean for your birth mom to be saying to you she's your real mom, right? Of course, we know that that's not positive adoption language. She is her mother, and so is her adoptive mother. But that can be really challenging for a young child to understand that terminology and really fully understand their story, even though it sounds like these adoptive parents have done a great job about always sharing this story and never shying away from letting the child know that she was adopted. But I think we can all agree that there's always a time in a child's life when some more adoption competent therapy could be just what they need to work through some of those confusion and feelings she may have surrounding um, what was said to her at this party, and then figuring out how to involve a birth parent and just saying, hey, she really struggled with the way this was phrased. Can we talk about maybe how we can phrase that differently in the future together, and involving a birth parent in that conversation as well?
Yeah, I would add to that. It's interesting because when you spoke on therapy, Elise, my brain went to who's involved in this situation. Is there any sort of agency or social worker or counselor or therapist? Because it does sound like there is a lack of education all around. So in whatever format we can go with that, I think that it'd be helpful for everybody to receive some support and guidance and counseling. First and foremost, language, I think, needs to be addressed. But then there's also some level of how is this birth parent feeling? What support and guidance and counseling have they been given to understand the importance of positive adoption language? Because this child is at an age, as you said, Elise, where they are starting to recognize what's happening and understanding things. So I feel like there needs to be support for each member of the triad, whether that's through therapy or a counselor or just someone who has more experience with adoption that can offer some insight. And then aside from that, there does have to be some boundaries set and some healthy discussion over, as a parent, this is kind of what works for our family, and I recognize that you may feel like you want to use this word as a biological parent, but we also have to do what's right for our family and our dynamic and our teaching of our child about their adoption story. So I think creating those healthy boundaries is always really tough between an adoptive family and a birth parent, especially if there's no guidance of an agency support or social worker support, because now you're having those conversations directly, right? It's not like you have social workers that can kind of communicate and help on either side. And my guess is in this scenario, they do have direct contact. They've always kind of communicated without the assistance of others. So it's almost like ripping off a Band-Aid of the adoptive parent having to sit down and maybe describe why this is hurtful or not helpful in trying to have this child understand things. So definitely a case where I think it'd be helpful to have extra support and guidance from somebody. But I also think progress can be made. I just think that people need a little bit of a realignment of their role and language and things like that.
Well, thank you guys so much for your insight, and thank you for answering this. And I will leave the link to this if people want to see the other response. But I think you guys did a great job talking about this. Now we can move to our discussion.
Okay, to keep our conversation moving, as Nicole mentioned before, we want to focus this episode on pregnancy options counseling and non-newborn options. So if we don't mind, Amanda, maybe you can start by talking a little bit about your experience in the field and the work you do at AFTH. I think people have heard what we do here, and you do something very similar, but you have a few different other roles as well, and we'd love to hear about those.
Sure. So I am currently a supervisor here at Adoptions from the Heart, but I spent the first 11 years of my career as an adoption counselor. We use kind of counselor and social worker interchangeably here at the agency. So I basically provided services for both adoptive parents and as well as birth parents, expecting and birth parents, excuse me. In addition to that, I am the birth parent post-placement support manager. So several years ago, I started our expecting and birth parent support group here at Adoptions from the Heart. At that point, it was in person. Since then, it has gone virtual since COVID. But it's really a space for pregnant women as well as women who have placed to come together and lean on each other for support. It's a really powerful resource here at the agency. Um, One of the biggest things I like about it is that there is a lot of flexibility in it. It's not like a strict thing that you attend and there's an agenda or anything like that. It's really just a space for women to come together and share their experiences of considering adoption, as well as placing a child. I also help coordinate our mentorship program. So we try to connect women with other women who are looking for support and guidance from somebody else who has been through it. We also have a few birth father mentors. So if any expecting or birth fathers are struggling and they really just want to connect with another birth father, we have that option for our mentoring program. So since becoming supervisor, I more so supervise staff that go out in the field and help counsel and support. But my heart has always been working specifically with birth parents. So really being able to connect and provide guidance to somebody who is pregnant or just delivered a baby or is possibly parenting a child that is 6 months old or a year old and they're considering adoption. It's always been the foundation of what I do in giving women and men the option to choose what's right for them and their families.
Awesome. Thank you so much for sharing. We're going to talk about non-newborn and parenting a little bit later, but we're going to start with pregnant people. Can you tell us how you approach the initial counseling process with individuals facing pregnancy, how you help them explore and understand their options?
So I think whether I'm on the phone with somebody who's calling me and saying, "Hey, I just took a pregnancy test and I am 3 months long," or I'm working with a woman who is considering placing a 5 month old child, I think the idea of options is still the same and consistent. My biggest thing is always making sure that the person I'm talking to knows that there is no pressure and no judgment. I actually feel like it's important at the beginning of your connecting with your client to build trust and have them recognize that I'm not somebody who's going to step in and make a decision for you. While I'm not your friend and I'm more of a professional, in this community, I am somebody that's there to provide you guidance. And I want that person to feel safe. I want them to feel heard and I want them to be able to fully understand what all of their options are so they can decide what's right for them and for their family, whether that's adoption, whether that's parenting, kinship care, foster care, if they want to do some sort of temporary arrangement with the state. We really go through all options first before even describing what open adoption would look like. And we may have to do that several times, whether that's at the beginning and then you choose a family and you say, "Oh, I don't know. Now I'm going back and forth. I have a new option." That's okay. But again, I always go back to creating a trusting, honest connection to your client so they know they can tell you anything, regardless of whether or not it's going to be adoption or not.
To add to that, also, I think that having some openness with them about my situation as an adoptive parent is always very helpful to my birth parents because I can speak directly to the experience from the other side of the aisle, essentially. And it also helps to humanize me a little bit for them. I think that, a lot of these people are used to dealing with professionals and case managers and social workers and that kind of thing. And they're used to not having control in those situations. As a matter of fact, their control is generally taken away from them. So being able to have an open conversation about between two people, even though there is a little power differential, we're still just two people going through a very shared experience, a very personal experience. And acknowledging that they do have control in many ways here that they may not have realized they do, and making sure it's very clear to them that they do have a lot of decision making in this process, and a lot of what's going to happen is in their hands to make choices is really something that is very helpful in building that trust in this relationship as well.
Sorry, I just wanted to say
Okay.
one more thing that one of the newer things over the last year that I'm learning is our role is also to remind that birth parent of why they came to us. The harder cases are women and men who may choose a plan and then they receive pressure from a variety of other people or other things in life and then they are questioning what they feel is in the best interest of their child. So I think another key role that we play as counselors and social workers is to make sure that we're advocating for what that birth parent truly wants, not just to everyone else, but also to them. We're the reminder of these are the reasons why you felt this option was what was in the best interest of you and this child. And you're having to kind of be that sounding board at times for them, which can be hard. But I think it's important to remember that we're in their corner regardless. But sometimes we also have to give them that, not tough love, but like that reminder of the reasons why they felt this was the right option.
Yeah, great point, Amanda. And I always love when anyone uses the word advocate, right? Like that's what we're here for. We're here to advocate for our clients in whatever decision they make. And I think it's a common misconception that when you go to an adoption agency, you're going to be counseled on adoption only, right? And that's not what we do here. We do a lot of counseling on all options, which is so important because this is not a temporary situation. You're making a permanent placement and a permanent decision for your child. And that comes with a lot of emotional distress for a lot of our clients. So I'd love to just hear when you all are working with clients that are really undergoing a lot of stress, really high emotions, which is normal. How do you help them through that and help them navigate really the grief that they're feeling when it comes to the decision or the process in general?
Well, I think first and foremost, you have to navigate who are the players involved. So what type of support or lack of support do these people have, right? So are there friends, family, who are the close people in their life that are potentially giving them advice or may potentially be giving them support? And I try to sit down and really go through the realities of what is going on. Going back to the trust part that I was talking about before, creating some sort of connection. Like everybody has their own comfort level. Should we sit and talk together in person? Should we grab a cup of coffee? Are you more of a texter? Are you more of let's sit on the phone or Zoom? Like you have to navigate what works for that client to kind of ease their nerves a little bit, because that's very important. Most folks that we work with don't want to sit with a counselor or a social worker and a clipboard and have them check off boxes. They want to know that they can connect with you and not feel this intimidation. So I think that is the first part to taking away some of the nerves and anxiety that's involved. But then being realistic about the pros and the cons of each of the options that we're discussing, maybe even writing it down on a piece of paper that person can go home and look at, but just trying to be as upfront, clear as we can be, because oftentimes people that are going through the emotions, the anxiety, the nerves, the whatever, they need somebody to kind of channel that a little bit. It's okay to let them vent and all that, but I think part of their coming to us too is to try to channel some of that and create structure to being able to figure out a solution.
To add to that, oftentimes, especially in emergency situations in particular, we're meeting in a hospital. They've just delivered this baby. They're likely still taking medication for whatever they went through in terms of delivery. So the situation is already intense and high stress. And now here in comes another person that has to sit down and ask questions where maybe they're tired, they're not fully off medication. So there's a lot that has to be considered. So we have to be a calming um, person that comes into the room, somebody that is very mindful of what their needs are, speaking in a way that we're sure they understand. So being mindful of the language we use. I know when I'm in the hospital and the doctors and nurses are talking to me, sometimes I don't fully understand all of their medical language. So we need to be able to translate and use language that is very clear, easily understood. Maybe we have to repeat things a couple times so that, or ask them to reiterate to make sure they understand. Because not only is it emotionally distressing, but it is certainly just environmentally distressing as well when you're dealing with all this in a hospital room. So we have to take all that into consideration.
I appreciate you both sharing that, and all of the information that you did provide. And I was curious, how there would be a difference in counseling a person who is pregnant versus counseling somebody who is placing a child that may be older, outside of the hospital, outside of discharge, outside of parenting already.
So we recently placed within this past 6 months two separate children. One was 6 months old, the other was 5 months old. In my career, that has not been super common. Most often, we do place newborns straight from the hospital, but we've been seeing more and more calls from folks who are considering placing non-newborns for a variety of reasons. And it's interesting you asked that, Nicole, because I think when I went to approach those situations, those thoughts went through my mind. Like, how am I going to counsel and support? Is it going to be different? There's definitely pros and cons, I think, to each, in the sense of it's that much harder, in my opinion, for a woman or a man who has taken a child out of hospital and chose to parent for a duration of time to then choose adoption, because you have bonded with that child. You have started that parenting process. So I think the idea of letting go and sacrificing for your child in many ways can be an even harder loss to face. However, one of the benefits that I've seen in my counseling is that these folks have already attempted to parent. So they already know the realities of what parenting is going to look like because they have lived it for those 5 or 6 months. Additionally, any family members who may have said, I'm going to help support you, have been able to show their true colors of actually supporting or not. So I think that when we're sitting down and reviewing options, just as we would with a pregnant woman, they're able to realistically see and know what has occurred with the parenting option. So I think that's been a benefit, in my opinion, with my counseling, because you don't have to think about what will it be like or could it be like, because you've already lived it for a duration of time. So I have found that to be useful in counseling with birth parents. And I feel like the non-newborns situations, they're not, I don't want to say quicker, but their decision making and their confidence, if they do end up choosing adoption, is a little bit faster because they've already seen and done some of the other options, if that makes sense.
When you're in that kind of situation, it's really important to remind them that in an open relationship, they're going to be able to maintain contact with the child if the child's facing some kind of medical issue, or if that's one of the reasons that they're feeling like they can't proceed with parenting because they're finding it to just be too much of a challenge because of what the child is presenting. Then they can be comforted to know that the child's being placed with somebody that has the resources and the opportunity to be able to provide whatever is needed for that child in terms of their medical needs or social emotional needs, what have you. So that's kind of a weight lifted, because it's, unfortunately, if the parent's not able to do it for themselves, at least they know they're making a decision that the child's going to get the attention that they need for those situations. And that's kind of a relief. And then being able to stay in contact and know that the child is getting the care that's needed, that things have improved, that additional specialists or doctors or whatever resources are being utilized to assist. It kind of a weight lifted off of them. So it's just beneficial to know and to make sure we continue for them to understand that that openness is there for them to feel comforted to know that this decision was in the best interest of the child.
Speaking of, how do you support adoptive parents in preparing for the emotional and psychological needs of older children? And we say older children as in non-newborn, which a newborn's considered, or an infant is considered 0 to 1 years old. So 1 plus, I understand this is such a broad question, but if you can share any of your experiences on preparing adoptive families for the emotional and psychological needs of non-newborn placements.
I think that in the situations I have seen, it has been children who are under the age that they kind of know what's going on, if that makes sense. So under 2 or 3, I did do a placement for a 7-year-old, which I think is a different situation that I can address. But for the younger ones, I think that there's still this idea that the adoptive parent or the prospective adoptive parent really has to be prepared to parent that child, knowing that they spent the first year or two with this birth parent. It's not as if you're dismissing that part to their story. We need to avoid the savior complex, right? Of like, I took this child in and saved them and whatnot. That birth parent or guardian or family member or whomever it is that had that child loved that child enough during that time period to make a good decision by choosing adoption. So I think it's very important that the prospective adoptive parent comes into the situation recognizing that and respecting it. I also think that the connection to openness, in my opinion, is even stronger or should be stronger for folks who are looking to adopt a non-newborn, because a majority of the time, those are the folks who want to have openness because they've already been with that child for so long. So whether it's through, having more visits or direct phone contact, like I see that often, the birth parents who are looking to place non-newborns want to have the direct contact to text or send videos. Also, what other birth family has been involved? Right. So we had a set of teenage birth parents here in Delaware that recently placed, and her grandfather was very much involved in this little girl's life for the first 6 months. He is her grandfather, and that will not change. So I think the adoptive parents coming into it have to be respectful of some of these additional extended family members or friends or aunts and uncles who may still want to be involved and provide love and know this child. So I think the I don't know what you call it, like the diagram of what birth families involved gets a little bit bigger, and you have to be open-minded to that coming into it as a prospective adoptive parent looking to adopt a non-newborn.
A couple points. Important to remember that that child, even if the child is a year old, is going to know that there were certain people in their life that are maybe not there as regularly anymore. And they're going to be looking for those people. And so the prospective adoptive parents, to Amanda's point, really need to be sure that they're going to maintain those connections because those are that child's people. And it might be a neighbor, it might be the daycare worker or something like that. Like the child will, at least in the early stages of the placement, still need to know that Miss such and such or Mr. such and such or grandma this or uncle that is around and is not missing to them, because adoption is based on loss and we can't forget that, and we can't ignore that there's loss. So even if it's a wonderful situation, everybody's all happy, there's still loss that has to be addressed. And to that point, all of our adoptive parents, but particularly those that are placed with non-newborns, need to learn how to parent an adoptee. They need to make sure that they're focused on attachment parenting, on making connections. And those things are going to be even more important if the child has been placed after living in another situation for the first X number of months or years of their lives. So the adoptive parents have to go out of their way to learn what it means to be parenting an adoptee and to make connections and to have attachment parenting and what that's going to look like for them. And if they are parenting already biological children, they need to understand that parenting an adoptee looks different than parenting a biological child, and adoptive parents need to understand that. And one of the reasons that I got into this field was because I didn't know that when I was parenting my children as young children. And so I am making it a mission to make sure that adoptive parents understand that they have to take extra measures and extra steps and educate themselves and advocate for their children in a way that is different probably than what they see their friends and family members doing with their own children. So that in particular needs to happen if you're being placed with an older child, because they do have a history, they do have a past that doesn't include you, and you need to understand and respect that. And there may be residual effects that the child is dealing with that relate to that. We don't know what the situation was like in the former home. And we can make assumptions. And one of those assumptions can be that something wasn't where it needed to be in order for biological parents to continue parenting. So those are things that will need to be identified and addressed by the adoptive parents.
Thank you for your
And I
vulnerability and sharing all of that with us as an adoptive parent, and your dedication to educating yourself and educating other prospective adoptive parents. Amanda, did you want to add something to that conversation before?
Yeah, I was just going to say, in thinking about the 7-year-old placement that we did, recognizing the transition may be different for each situation when you're dealing with an older child. Transition meaning, if you think about it, a child, especially a school age child that's being picked up and moved somewhere else, there's a lot of layers to that, and making sure that we're thinking about all the layers of school, friends, family, doctors, if there's been any sort of mental health involved. You have to honor that as the adopted parent and make sure that you realize you're, again, not just picking up a child and saving them and going to Disneyland, right? There's important pieces that have to be addressed, that I don't know if people really think about when they're thinking about newborn placement, right? Because it's a little bit different. So just honoring that, I'm a big believer in therapy. I know that Elise talked about that before, making sure you're working with a therapist that is competent on adoption, and making sure that the child is involved in some way, and maybe they go to a few sessions and you're okay to take a pause. But I'm a big believer in older child placements and getting involved in some sort of mental health that can help bring out maybe some things that happen that will be helpful for you as a family moving forward. So I just wanted to hit on that point because I don't know if folks really are prepared for that, which is why our agency has developed a non-newborn education class specifically for some of these important factors that are involved with older child placements.
I just wanted to follow up. I recently, as of yesterday, went to a webinar through the National Council for Adoption where it was addressing adoption medicine. And one of the doctors that was on the webinar said that therapy can start as little as a year old or 2 years old. There is 0 to 3 therapy. So you may think that sounds strange to have such a young child that maybe isn't even speaking in full sentences, speaking with a therapist, but there is value in it. And those doctors are designed and educated themselves in order to be able to work with this demographic. But there is a need because, again, we come back to that loss. And for children, it's a primal loss. It's something that's in their limbic system, it's in their bodies. They feel it without being able to understand what it means. And then those feelings are expressed through behaviors that may be identified by a parent as something other than what they are, and may be addressed by a professional as something other than what they are. So it really, which then would exacerbate the problem and make it worse. So it really does need to be addressed by adoption competent professionals who understand the impact of adoption on the child's physical, mental, emotional, social well-being.
Thank you
Yeah,
so much for sharing that. And I couldn't agree more. I have been a foster parent for several years, and all of that hits home very well. And I think people sometimes think that there's, I love the permanency of adoption, of course, but the children that are non-newborns or even newborns are experiencing a great loss as well. And I just wanted to plug, in addition to therapy and attachment and our non-newborn education course, something called TBRI, Trust Based Relational Intervention, is just phenomenal training and highly recommended to all adoptive parents, but specifically to prospective adoptive parents looking that are open to older children or non-newborn children. I did want to ask your professional and personal opinions on what changes or improvements would you like to see in the field of adoption when it comes to option counseling?
A loaded question. A lot, a lot. I mean, I don't think any of us have all the answers, and I'm always looking to grow and improve in how I approach my clients and continue to provide counseling and support. But I think there's still a lot of stigma, a lot of judgment, a lot of stereotypes. I wish that all community members, well, I wish everyone, but more so folks who are communicating and dealing with the clientele that we work with, doctors, hospitals, OBGYNs, therapists, Planned Parenthoods, like all of them really need to take away the stigma of potentially choosing adoption, because I still think it's there. I do. I think that there is a lot of pressure put on women specifically over what decisions to make. Um, Positive adoption language is still not being used in all facilities. And I think that's influencing options counseling. So I think that trying to create a judgment-free zone where there is no pressure is always the ultimate goal. And we have to continue to work hard as people in this field to try to do that. So I think that it's useful to use your clients to learn and grow. Every time I'm meeting with a birth parent or an expecting parent, I always use it as a moment to try to say, what am I taking away from this person? Even though they may be coming to me for my services, I'm also coming to them to learn about them and improve on my approach. So I think that people have to be open-minded. We're in a different world today than we were even 5 years ago, with a variety of things that are going on in our country and whatnot. So I think people just have to be mindful of that, because there's a lot of isolation. I think women and men are feeling very disconnected, and it's hard to make decisions. Our economy is really rough. Financially, things are not the same. And while some of our state services are trying to improve, they're still not quite there. So just trying to be mindful of that when you're approaching a client who's pregnant or just gave birth or is looking to place a child that they've already been parenting.
I think on top of that, making sure that people understand the broad definition of open adoption. Creating a family is an amazing resource that, aside from listening to our podcast, I would encourage all of our listeners to tap into. It's been like my complete go-to for anything and everything adoption. But there was a recent podcast that discussed what is the definition of openness. And I think it really is being better understood, that openness is not just having a relationship or having a connection, because frankly, that's not for everybody, and not every birth parent wants that. I've dealt with several birth parents that, for whatever their reasonings are, they kept their placement of their child private. Nobody knows except maybe one other person in their life. And they don't want to have any kind of connection with the adoptive parent and the child. So for that adoptive family who came to our agency looking for this lovely, relationship with birth family, that's not going to be a reality for these people. So if you broaden the definition of openness to understand that it's the desire and the goal to have as much information presented to the child as possible, and that it's an open discussion about adoption, and the child is not kept in the dark about anything. They're given whatever information we have. They're given as much information as we have, and they're given tools to understand that information and to process it and to help them form their identity based, on what they know. And if it also includes a relationship with birth family in some capacity, that's terrific. And that's something that we feel would be great if it serves everybody that's involved. In some cases, it may not benefit them and it may not be possible, but it's a goal to just understanding that the knowledge of the adoption and the knowledge of as much information about themselves is there and possible. So I think, birth parents understanding openness, and that openness is designed for just everybody to kind of just not have anything hidden, not have anything in the shadows like it has been in the past, to the best of their ability, also helps with some of that options counseling as well.
And I really want to hit home what we talked about before, that options counseling truly is that it's presenting options, because I want our community members to remember that when you call us, when a social worker comes out to meet your client or meet your patient, we are not there to push adoption on. We were just interviewing a hospital social worker a couple of weeks ago, and one of the reasons why she said she loves working with us is because she'll make that call and somebody will immediately stop what they're doing, drive to that hospital, sit with that woman who just delivered a baby, and really talk to them. They don't throw adoption at you. And she values that in the work that she does. And that is what we stand for. I mean, most of us as social workers came into this field because we want to quote unquote help people, right? We're not here to push that. And people sometimes don't get that, because I think Elise said this before. They think we're an adoption agency, so that's all that we're about. I've had many colleagues or staff that I supervise call me after being called to a hospital and counseled a woman, and she ended up deciding to parent, and they're describing to me exactly what went on. And I say to them, that's a win. That's a win in my book. You helped that woman decide what she wanted. And yes, it was a lot of work and a lot of counseling and a lot of back and forth. But if she ultimately feels that that is what she wants for her child is to parent, you are successful in the role that you played in her life. So I want people to hear that, especially adoptive parents coming into our program. We don't push adoption on our clients. We create a space for them to figure out what they want for their child, and that is valuable in your ability to be placed and move on to parenting that child. Because if you don't have that as a foundation, the idea of how people will identify and go through the loss and the grieving, it will never work fully, right? Because the idea of somebody taking away a child versus somebody voluntarily choosing to place is completely different. And I think once you truly understand that, you will understand the work that we do here at Adoptions from the Heart.
Now it's time for our Ask Anything segment. Thank you, everyone who submitted a question. Make sure to leave your questions on the comments on our YouTube channel or on our Q&A portion of Spotify. So today's question, I would also like Amanda and Sheila to be part of this segment. So you guys are welcome to answer part of this question if you want, but this is today's question. We have a question from Pete. Pete is asking, my girlfriend and I have a 2-year-old and we've been struggling financially and emotionally with parenting. We're not sure if adoption is the right choice for us, but we are thinking about it. It makes me embarrassed to even say that it's one of the options we are thinking about because we made the decision to parent 2 years ago. We love our child, but don't know what to do. How do we start the process to place our child for adoption? And if we start that process and change our mind, what happens? So anyone can start or answer this question.
I mean, I'll just start by saying I think there's, shame and guilt around the thought of speaking to somebody about potentially making an adoption plan. That's normal. That's natural. We never want somebody to feel that way because it's not a shameful experience. It's not a shameful decision, but we certainly understand why there are those feelings around that. The first thing you have to do is, make a phone call. Just put it out there. Make a phone call or a website inquiry, whatever you're comfortable with, and let a social worker just talk to you about your situation and what you're struggling with the most and how we may be able to help you as an agency. And we start with all of our options counseling, what we've been talking about, here today, about what does parenting look like for you, and are there things that you may need to continue successfully parenting, or are you at a place where it's not working and you need to make another option? And if so, we can talk to you about that as well. But, like we've been talking about here today, we're here to hear your story and figure out how we can provide you with resources, whether they're our resources or whether they're outside community resources to help you continue parenting, or make a temporary, placement, foster placement, or placement with a family member, whatever might work for your family.
Yeah, and I would also just add to that, in addition to a lot of the services we've been talking about, because we talk here at the agency about the wraparound services before, during, and after that we provide expecting and birth parents who may be considering adoption. You may be somebody that wants to connect with another birth parent who has placed a non-newborn or a newborn, just to really understand from them what it's like. We have a case right now of a set of birth parents who have been parenting a little one for a month, and they're considering adoption. And we connected them with another birth parent who placed 7 years ago. And I hear that they've had very long phone conversations where she's been able to really give them the good, the bad, and the tough of what it's like to be a birth parent and choose adoption. And I think that's crucial when you're considering your options, because it's one thing to lean on us for support at the agency, but I so value our birth parents who are willing to share and be mentors to our clients because they're able to hear from people who have lived it. And again, judgment free. Those birth parents say you got to do what's right for you. It is hard to place. It is, a loss that you will face for the rest of your life. But I know in my heart, I did this for my child, and my child is living the best life that he or she could have because of that decision. So I just think it's important to remember that if you are considering talking to somebody about your options, like Elise said, make the call, shoot a text, go online to our website and do an inquiry. There's a community of people who will support you in whatever option you choose. Know that you have a team behind you. You're not alone. You don't have to feel like you're going through this by yourself. We want to be there for you.
I'll jump into that also, that you may do that. You may reach out, you may speak to somebody, you may feel good in a decision to make a plan to place your child. And now you have to explain it to the people in your world who have seen you parent this child for 2 years. We'll assist with that also. If it means, meeting with other people in your life to help educate them, that is something that we can assist you with. We'll provide you with resources to talk to them and educate them. We'll do whatever we can to help you so that you can feel comfortable in sharing why you made the decision. Because I know that the shame and the loss and the grief are all real. There are 7 core issues in adoption that affect all members of the adoption triad, which is the birth parent, the adoptive parent, and the child. So addressing those core issues and understanding how you're feeling and how they're impacting you is going to really be helpful in moving forward after the decision and coming to terms with it. But also it's going to be helpful in explaining and helping other people in your world understand, because whether we like it or not, people in our lives have opinions about the things we do and make us know them, and we have to learn to live with that. So we will help you to help them understand how you got to this point, if in fact you do.
We could talk about this all day. I know I say it at the end of every podcast. This has been such a wonderful conversation, and I know that this is just the tip of the iceberg on options counseling and non-newborn adoption. And I hope to explore this further. And Amanda and Sheila, we would love to be able to explore this further with you in the future, and appreciate you so much sharing this wealth of knowledge. But again, just the tip of the iceberg with us here today.
Thank you for having us.
Thank you. It's my pleasure.
What a wonderful conversation. While also experiencing the heaviness that comes along with options counseling and what parents are experiencing when they feel that they need to explore their options. As a parent myself, I have a lot of empathy, and I appreciate all of the things that adoptions from the heart social workers provide to families that are exploring options. And I believe in our families and our services, and allowing expectant parents and parents who are parenting to explore all options with no pressure and with only a support and a hug and a listening ear. So thank you, Amanda and Sheila, so much for sharing everything today. Elise, what was your main takeaway from our conversation?
I mean, we talked about so much and it was all so important. And, one of the things we talked about was that there really is still a stigma around adoption these days. There's still a lot of uninformed people out there that just don't understand adoption or the process of adoption or why somebody might choose to make a plan for their child. And I think it is those stigmas that lead to a lot of those feelings of shame and guilt for our birth parents that do make these decisions. And so I just want to, put out there for anyone that may be listening that it's such a selfless decision to choose to make an adoption plan for your child. And I just hope that we as social workers make, our own clients feel that way. But for those of you that may be listening that haven't worked with us or had a negative experience, I just hope you know that we all commend you for making an incredibly difficult decision that you felt was right for yourself and for most importantly for your child, and you put your child first, and that's commendable. Nicole, what about you? What would be your sort of main takeaway from today?
Everybody has opinions, and we all have bias in all sorts of different areas. It's not specific to one. That's understandable. I want to we recognize that birth grandparents are also facing a loss. Birth aunts, uncles are also possibly facing a loss when a parent makes an adoption plan. And while recognizing that, also giving the support to the parent who is experiencing the biggest loss and being able to separate that and being able to support people and love people who are in your family and help them through this. I often now, with just growth and maturity and learning throughout the years, when somebody's struggling through something, whether it's a friend or a family member or coworker or anyone, I've gotten into the practice of, do you want advice? Do you want to talk about a possible solution? Or do you just need me to be here and listen? And offering those options. I'm a very solution-based person, so I've always just gone there. But that's not always what somebody needs in a moment. Again, whether that's a professional relationship or a personal relationship. So that's my parting thought amongst a billion infinity other thoughts that I'm sure we'll get to explore at another time.
Well, to everyone listening, thank you so much for tuning into this episode of Adoption and Beyond. We truly appreciate Amanda and Sheila for sharing their really valuable perspectives on options counseling and non-newborn adoption. We hope you found this discussion as enlightening as we did.
If you enjoyed today's episode, please take a moment to rate, like, and subscribe to our podcast. Share it with someone who might benefit from this information. And don't forget to subscribe to our YouTube channel, Adoption and Beyond Podcast.
And if you haven't already, visit our website at www.afth.org to learn more about our services for pregnant individuals, prospective adoptive parents, and professionals interested in adoption. Thanks again for joining us, and we look forward to connecting with you in our next episode.